We will be discussing leishmaniasis. So, leishmaniasis, it's a protozoal disease caused by the protozoa known as Leishmania. Now, so starting with the introduction, this is a vector-borne protozoal disease. So it means there should be a vector responsible for this. So as you can see in the slide, there is a fly with a red color tail in it. This is because of the blood sucking. So this is the vector known as sand fly. Okay, so that's why it's known as a vector-borne protozoal disease. Now, this protozoa, it's an obligate intracellular parasite. So in later part of the session, I will explain you why it's called obligate intracellular parasite. Okay, so there are three clinical forms of this leishmania that exist. That is visceral form, cutaneous form, and a variant of a cutaneous form that is known as mucocutaneous form. Other than that, we have a diffuse cutaneous leishmaniasis and one more, but it's not much of an importance. So we will be discussing major three of them over here. Okay. Now, so starting with the classification, so this leishmania, it's a protozoa, so it belongs to the kingdom Protista, phylum Sarcomastigophora. The class is Zoomastigophoria. Order is Kinetidoblastida. Genus is Leishmania. Now, the important thing that you have to remember is the genus. Genus is Leishmania, and other before this species there is subgenera or the subgenus of Leishmania that is known as Leishmania leishmani or Leishmania vinii. Okay, and then we have species of the Leishmania that is known as the Leishmania donovani, Leishmania tropica, Leishmania brasiliensis, and Leishmania mexicana. Next coming to the morphological form. So Leishmania, as we told, this is a protozoa, and it's a flagellated protozoa. So it will have flagella in its body structure and a single flagella actually. So there are two main protozoa that are just with one flagella, that are trypanosoma and Leishmania. Okay, so Leishmania exists in two morphological forms, the first being amastikoid form and the other is mastikoid, promastikoid form. Amastikoid form, this exists in the vertebrate part of the cycle that occurs. So it is amastikoid form you will see in human tissues and in macrophages. Okay, so human tissues such as spleen, liver, and bone marrow. So you will find amastikoid form over there, and also in the macrophages or the cells of the body you will find amastikoid form. Now, this amastikoid form is a round or oval in shape with a 2 to 5 micron in size. There will be a presence of a nucleus, and other than that, there will be two kinetoplast, or kinetoplast will be present surrounding the nucleus. Okay, so from these kinetoplast that are mitochondrial DNA remnants, okay, from which the flagella arises. Okay, and this amastikoid form itself is non-motile because the flagella is not properly developed. Then we have promastikoid form. Okay, so the promastikoid form, so the promastikoid form, this is this part of the protozoa exist in invertebrate. Okay, so it's mainly in the sandfly and the culture media that you will find this promastikoid form. Okay, so this will be elongated 10 to 20 micrometer in size. It will be having a single free flagellum, so as we mentioned earlier, and because of the presence of the flagellum this will be motile. So here, as you can see that there are two forms that we discussed earlier. So the amastigot form and the promasticate form. Now remember, amastigot is non-motile. Okay, so you can remember it's a non-motile or amotile, and the promastigot is motile because of its flagellum. So you can see both are having the nucleus and the kinetoplast, which are mitochondrial DNA remnants. Okay, and there are two kinetoplasts actually. From the one of the kinetoplasts, the flagellum will arise. Okay, and the inner portion of the flagellum, which is intracellular in this protozoa, this is known as axoneme. Okay, and axoneme continues as flagellum in the outer cellular part. Okay, so life cycle of leishmaniasis. Now leishmaniasis has occur in two different parts, like, or we can say that it occurs in vertebrate and invertebrate. Okay, so in the vertebrate part, we have as an host will be dog, man, or some rodents. Okay, in which cycle will occur. And the invertebrate, or where the promastigot form will mainly occur, it will be in the sandfly. Okay, so the sandfly, it will be phlebotomous, but the species form of the sandfly will change depending upon which type of leishmania we will be talking about. Okay, so this is a simple diagram that says, so you can first of all see that there is this infected sand fly, and in the infected sand, particularly this will be female, because female needs a blood meal for the the growth of its ovum, or the baby baby growth. Okay, so that's why this insected female sandfly mosquito will bite the human or rodents or dog, and biting of while taking the blood meal, the promastigot form that occurs in the alimentary canal of the female sandfly mosquito will be transmitted to the skin surface of the humans or rodents or dogs. Okay, now as the promasticot form reaches on the skin of the humans, okay, this will be phagocytized by macrophages that are present in the skin. Okay, now this phagocytosis of promastigot form by the macrophages is mediated by some antigens and mediators, which is mainly done by the promastigot form. Okay, now once the promastigot form is phagocytized by macrophages, it will convert into a mastigot form, where it takes nutrition and grow in number and divides and multiply. Okay, once the number of a mastigot form increases in much larger number, then it will burst from the macrophages, and it will get into the circulation. In this circulation, it will reach into the various parts of the body, mainly that will affect the reticuloendothelial cells or the systems of the body, which mainly includes spleen, liver, and the bone marrow. So that is why in the later part of the discussion, you will see that the discussion mainly focuses on the features related to the bone marrow, spleen, or liver. Okay, so where the reticuloendothelial cells are present in these areas, this will be invaded again by the amastigot form, then they will divide, that will convert into promastigot form. And in the next part, where the female again takes the blood meal, it with the promastigot forms enters from into the female alimentary canal, where it will be converted in, where it will be further converted, and it will be transmitted to the next person. So talking about the epidemiology. Okay, so as we discussed that the main forms that we have to remember is known as visceral leishmaniasis, cutaneous leishmaniasis, and mucocutaneous leishmaniasis. Now visceral leishmaniasis in some parts of the country, specifically in India, it's known as kala azar. So kala azar, the translation being black fever, because in the beginning of the disease or the infection we can see that there will be a high grade fever which will be twice or three times that will be rising in within the 24-hour period. Okay, so as so in discussing about the geographical distribution in India, mainly it will be in Bihar, West Bengal, Uttar Pradesh, and Jharkhand. Majority of the cases are reported from Bihar, like it will be about 70 to 75% cases are reported from Bihar. Okay, then the cutaneous form of leishmaniasis, this is mainly seen in southeast or Afghanistan, Iran, Pakistan, and Mediterranean. Mucocutaneous form, this is mainly seen in South and Central America. The other part will be Brazil, Peru, and Bolivia. Okay, so starting with a visceral leishmaniasis or kala azar. So as I told you earlier that kala azar is the name because it's black fever, because the term itself describes the fever pattern. Okay, and why it's known as kala means black color. The black color is related to the presence that in India it will, in Indian variant of leishmaniasis, it will cause hyperpigmentation of faces, trunk, and the body parts. That's why it's known as kala azar. Okay, so that's how the name explains kala azar. So as we told earlier that the bite of the mosquito, of specifically the female sandfly phlebotomus, okay, will lead to the promastigot form, and this promastigot will further be ingested by macrophages, will further evade, and it will reach to the reticuloendothelial system, where the reticuloendothelial cells will be present, and it will destroy them. So the reticuloendothelial system mainly involves spleen, liver, and bone marrow. Okay, so amastigot forms multiply within the macrophages. They will cause cell rupture, and progressive parasitization will occur. Now because this will affect the area, so there will be inflammation going on. So we can see the, because of the spleen involvement will be splenomegaly, the liver involvement will cause hepatomegaly, and the bone marrow cells will be damaged, so it will lead to bone marrow suppression. Okay, so because of the bone marrow suppression we can see the features such as related to anemia, leukopenia, and thrombocytopenia. Okay, now because this amastigot form will cause the activation of body immune system, and body immune system will react with the help of B cells and T cells. So activation of polyclonal B cells or the plasma cells particularly will lead to hyper gamma globulinemia, because the antibodies will be released, and this hyper gamma globulinemia will be seen on a chronic antigen stimulation. Okay, so it will be not seen in the early phase of the disease. Okay, so immune response, so there are two immune responses that will, so first of all will be mediated by T helper cell 1 response, which will be mediated by, so this T helper cell 1 will release interferon gamma, and this provides protective immunity. Now the T helper 1, T helper 1 actually it provides cell mediated immunity, which is a delayed time of immunity. So it will be seen in the later part of the disease, like where the disease is about to heal. So it's also known as post Kala azar dermal leishmaniasis. It's seen in the T helper cell will be seen there, and other than that, the in a visceral leishmaniasis it will be also seen. Okay, now the other type of response that we can see because of the host immunity will be T helper 2 response. This will be mediated by the release of interleukin 4 and interleukin 10. Okay, so because interleukins are released and this is mediated by polyclonal B cells activation, okay, that will lead to hypergammaglobulinemia, and this will be humoral immunity. Okay, so this will be seen during the active phase of the disease, whereas T helper 1 is mainly seen during the healing phase or the later phase of the disease. Okay, so here we can see the image where the child has a non-tender abdomen become mainly because of the spleen enlargement, and which is followed by liver enlargement. So this will cause hepatosplenomegaly. Okay, so this is mainly seen the visceral form of leishmaniasis. Okay, now discussing about the other forms of leishmaniasis, whether being that mucocutaneous leishmaniasis. This is a variant of cutaneous leishmaniasis. Okay, so it begins as a cutaneous lesion, later involves the nasal septum, lips, and the palate. So that's why we can see the destruction of the nose bridge, the palate, and the lips. Okay, so that's destruction will cause to the disfiguration of the face. Okay, so this tissue destruction that is caused, it's known as espundia. Okay, so that is classical facial deformities, in that specific term that is known as espundia. Remember this. So now the post kala azar dermal leishmaniasis. So once you treat kala like the leishmania, okay, so after the treatment with mainly antimonials, for antimonial drugs. Okay, so this is a reaction that occurs because of the presence, as we discussed, that T helper cell 1 involvement, that is delayed type of hypersensitivity. Okay, so appears after the treatment of visceral leishmaniasis due to the persistence of parasite in the dermal macrophages. It's an important reservoir for the transmission, because as the amasticot form exists in the macrophage, whenever they will rupture, they will again cause the uh, disease. Okay, so starting with the clinical features. So the incubation period varies from 2 to 6 months. So patient can have previous exposure, and then it will take a long time for them to occur. So the symptoms are not on fast basis. Okay, so starting with the symptoms, so as we named that, it's azar, like the fever. So it will be irregular fever, that will be high grade fever, that will be rising twice or thrice in 24 hours. There will be malaise, and weight loss is the prominent feature. So any patient present in endemic areas presenting with more than 2 weeks history of fever followed by malaise, and then progressive weight loss should be suspected of visceral leishmaniasis, and the laboratory findings has to be done to confirm the presence. Okay, so signs, we can see like massive splenomegaly, that will be non-tender, and then hepatomegaly, and then it will be anemia on the CBC, and hyperpigmentation is one of the variant, that's why it's known as kala azar. So as we mentioned earlier. Okay, complication, because this will make the because the immune system is highly compromised in this patients, because of the constant attacked by the protozoa. Okay, so that's why patients can in the later phase of the disease, patients can have easily secondary bacterial infections, bleeding, and cachexia. Bleeding is mainly due to the thrombocytopenia and coagulation cascade disruption. Okay, cachexia will be mainly because of processive weight loss, and in untreated patient, the mortality will be more than 90%. So how to diagnose the disease, and how we will proceed on when the patient presents to us. Okay, so suppose a patient comes to you with an history of more than 2 weeks of fever, progressive weight loss, malaise, and some amount of hyperpigmentation going on. Okay, so first of all, we will take the sample. Okay, so sample you can collect, we can do microscopy. For the microscopy, we can have samples from various spots. So uh, splenic aspiration. So spleen aspiration, this is the most specific sample that we will receive, but it will be hard, because splenic aspiration can lead to hemorrhage in the spleen, and that's very life threatening. So that's why splenic those splenic samples are considered very good, and it's very specific, but that they are not the most common. The most common sample being the bone marrow aspirates. Okay, so we will be receiving bone marrow aspirates for the microscopy purpose. Other than that, in the African form of in the African variants of leishmaniasis, where the lymph node will be involved mainly, so lymph node aspirative can be there as well, and the skin smears can also be used for the microscopic purposes. So once we receive the samples, this splenic aspiration or bone marrow aspirate or bone marrow biopsy and the lymph node aspirate, we will do smear with the staining. The staining will be, of course, GIMSA staining over here, and in the GIMSA staining we will see Leishman-Donovan bodies specifically. So what is Leishman-Donovan? So let's see there. So over here you can see this is a macro. So this is a microscopy slide where we can see that there is a macrophage, and within the macrophage there is a presence of a mastigot form of protozoa, which is pointed over here. So this presence of a mastigot form into the macrophage is known as Leishman-Donovan bodies, which will be seen on the sample obtained from splenic, bone marrow, or lymph node. Okay. We can also culture this. So the culture media will be specifically done in uh, triple N medium, that is known as Novi's McNeil's Nicole. Okay, so this will cause a promastigot form growth. So as we discussed earlier, that promastigot will be seen only in two places, either in the skin, either on the skin inoculation by the not the skin inoculation, or by the while the insects bite. This will lead to the promastigot form into the skin, or only in the culture. Okay. Animal inoculation is done in the golden hamster specifically, or we can see a mastigot form multiplication, but it will take months to develop. So that's why this is not much done for diagnostic basis, but it is done on research use only. Okay. Serological test, we can check for antigen. So the test that is done is RK39 antigen test, and other than that we can do for antibodies the ELISA, IFA, and direct agglutination test. Okay, that will detect antibodies of the protozoa. Okay, the emasticot form. Other than that, we have PCR. Now the PCR is mainly done for the, as we said earlier, the kinetoplast. So the kinetoplast present in the promasticot form or amasticot are the kinetoplast is a mitochondrial DNA remnant. So PCR is done for that. So that PCR will show the presence of DNA remnant of mitochondrial DNA that are present in the kinetoplast. That will confirm the diagnosis. Okay, so it will be helpful in a species identification. Okay, then we have Montegro, also known as Leishman test. This is an intradermal inoculation. Okay, so intradermal inoculation of the dead protozoa into the skin is known as Montegro test or the Leishman test, and it is because of the delayed hypersensitivity. So mainly T helper cell 1 will be involved, positive in mucocutaneous. Okay, and it will be negative in active visceral disease, as we discussed earlier, that in active visceral disease T helper cell 2 will be involved, so that will be humoral immunity. But in the healing phase of the disease, mainly it will be uh, T helper cell 1 involved. Okay, so this is the Leishman-Donovan body. Now for the treatment, so previously antimonials were used for the treatment purposes, but because of the infrequent use, a higher amount of resistance is seen in from the antimonial. So that is why nowadays the drug of choice is liposomal amphotericin B, which is in the dose of 3 to 5 mg per kg. IV for 5 days is preferred, and so this is the drug of choice in India for visceral leishmaniasis elimination. Okay, and the miltefosine is used in 2.5 mg per kg per day orally for 28 days. So this is since it's teratogenic, so it's avoided in pregnancy. And paramomycin is 50 mg per kg per day, IM for 21 days alternate. Okay, so prevention and control, because this is caused by a sand fly, female mosquito. Okay, so that's why vector control is an important. So insecticide spraying, mainly DDT, or the insecticide treated nets or sand fly habitat elimination will lead to abrupt stopping of the disease. Reservoir control, so treat the infected dogs or rodents or population that have this disease, so it will again cause the stop of the disease. Human protection, so protect, so because this is caused by bites of the sandfly. Now sandfly do not fly to a longer distances, so the sandfly mainly jumps. So that is why this sandfly cannot reach to a higher level of places, like too much above the ground. Okay, so that's why making houses above the ground in the endemic areas, and wearing protective clothes that covers almost all the skin surfaces will be one of the method to prevent the disease. Okay, and using these definitely repellents or the insecticides repellent, that will help. Surveillance is important, so early detection and treatment of human cases, that will be done by a part of doctors and team. Okay, vaccination, right, till date there is no effective vaccination developed, but research purposes are going on. Okay, and killed and recombinant DNA vaccines might be available, but it depends on the research. Okay, so differential diagnosis is also important. Now every patient presenting to you with a fever and malaise and weight loss will not definitely be leishmania, so you have to remember these. So okay, so if we performs CBC, and there will be the periodic fever history will be also in malaria. Again, it will be parasites in the RBC. So parasite in the RBC, it will be seen on peripheral smear. Okay, typhoid, we will be having the step ladder pattern, and there will be positive Vidal test. For lymphoma and leukopenia, there will be lymphadenopathy, and atypical cells will be seen, like the Reed-Sternberg cell and all. Okay, and for the histoplasma, similar histology, but the past positive yeast will be there. So thank you for listening me out. I will try to get more updates on Leishmania and will post earlier soon. So let me know your thoughts and any update if you want on this topic. I will definitely mention in next upcoming sessions. Thank you.